Hi, my name is Commander Danielle Cuevas. I am the Site Director at Naval Hospital Jacksonville for the Nurse Anesthesia Program. Today I'm going to present LAP AR by Inovus Medical. If you are in the medical field, you appreciate that most specialties rely on other consulting services to provide patient care that is safe and efficient. Anesthesia services are offered in a wide range of modalities to optimize patient comfort and to facilitate the surgical procedures. There is an inside joke among the providers regarding surgical time in quotations and the actual time. Far too often we are sold on the idea of a quick add-on case that turns into the most difficult case of the day. There is a noted difference between the residents and junior fellows compared to seasoned providers. Military medicine has progressively been downtrending in patient acuity as well as the number of surgeries daily due to the divestitures that the DHA has permitted. The utilization of simulation devices should be used to bridge the gap until these services increase in the future.
Hey, anesthesia, I need to add on a case. Come on, I was just about to go home. Oh, it'll be quick, an hour, tops. An hour? Yeah, if that. Fine, but if you go long, you have to do something for me. Sure, fine, but it's not gonna go long. I'm sorry, this is the worst hernia I've ever seen. You really gonna make me do this? Nurse, could you give me the phone, please? Hi, is this Mrs. Anesthesia? This is the surgeon. Your husband won't be making it for dinner tonight. And I have nobody to blame.
Prolonged surgical time is not just an annoyance to the anesthesia provider, but it also produces significant risks to the patient. This slide lists some of the common risk factors for anesthesia just in general. The longer the patient is under anesthesia, the higher the risk factors become. So basic risk factors include nausea and vomiting, sore throat, postoperative delirium, muscle aches, itching, hypothermia, difficulty urinating, nerve damage, headache, pneumothorax, hematoma, minor back pain, and that's just to mention a few. Inovus Medical is a company out of the UK who designs and manufactures surgical training technologies. They advertise that their purpose is to improve surgical care through connected training. The mission is to become the world's partner in surgical training. And finally, their value is accessible, affordable, and functional surgical training. LAP AR is one of the surgical simulation devices available by Inovus. This simulation allows for the user to perform simulated full surgical procedures as well as basic skill tasks by connecting to a PC or a laptop. Performance data is captured and displayed in the online portfolio and can be downloaded into training portfolios or logbooks. Key features of this system include close-to-life haptic feedback through synthetic soft tissue models, realistic digital anatomy fully integrated with the soft tissue models, full procedural simulation in multiple specialties. The device triggers and manages intraoperative complications. It gives objective feedback on key metrics for surgical performance. It allows for performance tracking on a validated curriculum and records and reviews training progress on an online portfolio. The simulation device starts at around $2,500 per package and includes the items listed on this slide. Of note, the system does not include the computer that is necessary for these features. It would be important to ensure that the simulation center's computer or other devices were compatible, or an additional budget must be made to purchase a device that has ample storage space and ability to connect to the internet. The LAP LR kits are also only single-user license for software and portfolio, so this suggests that multiple units may need to be purchased. This next illustration is directly from the company, discussing all of the features for the LAP LR.
LAP AR is the platform for connected surgical training, promoting collaborative education for better patient care. With a full suite of modules for all surgical specialties. And a take-home version that allows training without boundaries. Simple to set up. And with our distance learning app, trainers can guide learning outcomes from anywhere in the world. Haptic feedback is generated by medical models and real instruments. And performance tracking shows progression and guides further training needs. Record live training events and receive written time-stamped feedback. Download performance data and add it to your portfolio. LAP AR. Connected training for better patient care.
The literature supports the use of simulation to improve performance and patient safety. Having an at-home laparoscopic simulation tool allows a surgeon to practice as much as needed in the comfort of their own home. They can get personalized feedback, practice several types of surgical procedures, and expose themselves to a variety of emergency situations without causing harm to patients. Secondary benefits, as they improve their proficiency, will decrease the amount of time the patient is exposed to anesthesia medications, limit the physiologic changes due to the patient's positioning, the abdominal insufflation, and just the surgical stress alone. And finally, provider-to-provider camaraderie will be improved. These videos are made in jest, but they do highlight some of the most common communication issues that we may encounter when working in a multidisciplinary team. Thank you so much for your time.
Hey, Doc, let me know when you got about 20 minutes left, okay? Yeah, no problem. And we are done. Anesthesia, you can wake the patient up now. Is there a problem? What is it you think we do back here? Well, do you think we have a giant anesthesia on-off switch that allows the patient to wake up instantly? No? No. Okay, take your time. Thank you. We done?
Thank you so much for your patience and time. Here are my references. Have a great day.